Dr. Ali, let's talk about some stats. So year one was 2006.
So 2006 is Pioneer Medical Services, and 2013 is when we started Pioneer Medical Group. So if you look at now in the span of 10 years, I mean, we have more than 200 clinicians throughout the division. Other than the critical care and pulmonary, lung programs, neuroscience clinics, and few other things. We also have consulting work. Different healthcare systems ask us to come in and look at their processes, look at their quality, and how we can improve those things. So I think that it makes it's an ongoing work always, but my mind is always working and trying to see if we can do something differently all the time.
So the question, Dr. Ali, in 2013, you're saying 2013 is really when PMG started, right?
Yeah.
Okay. 2013, how many what do you say, clinician or you say provider? What's the
I like clinicians. I don't like the word provider. I think it's a negative connotation in my mind. So I went to I used to work at Advent Health System. I'm always been grateful. They they have trusted me, especially with the background and everything, coming to this country, and I don't even know how to speak English properly. That they thought that they trusted me, so I was employed by them. I went to some of the CEOs. I sat them down, 3 or 4 of them, and I will never forget that moment that I sat down and I said, "Hey, I would like to be fired." And they started laughing. And I said, "No, I mean it. I would like to be fired." And it was Brian Adams and in Orlando, Bruce Bergam, and then few others. And finally, I convinced them after a few months that I can be fired and I can start something on my own. And I told them with extreme transparency that I may crawl back to you in 6 months. And because I have never done any of those things, I've never done business. I don't know how to do it, but I know that I can. I've learned enough, and I will continue to learn to do something different. And that's where this whole thing started.
How many clinicians did you have? How do you say the word, doctor?
Clinicians.
How
so
many
we have more than 200. Medical, and then Pioneer Critical has a separate set of and the APPs, and same is true for Pioneer Neuro. So I mean, all in 280 or something like that.
How many you start with in 20?
So I went from one. Yeah, I mean, we went from 1 to 5 in 2013. And from 5 to where we are today. So,
okay,
the numbers itself, I mean, I don't think that matters as much as the impact that we have made in people's life, patients' life, and some of the people who decides to work with us. I don't like the work employees because all the people who work with us, they have choices. And so, yeah, I think that's
amazing. Dr. Ali, from 1 to 200 revenue, if you can share top line revenue, the bottom line.
I mean, don't take this at I mean, we are probably dealing with almost 100 million between different companies.
How about back then, year one? What was the number back
then?
Oh,
year one, 60,000, man. I invested. I was just talking to my partner that I had $110,000 in my account at that time, and and of course I have to pay the mortgage and the babies and everything. So I said I'm going to put 60,000 in. I asked my other 5 partners at that time. I convinced them to leave employment. I mean, some of them were really, really irritated with me, but I convinced them that we have a chance. So we all pooled in 60,000, the 6 of us together, and I told them that don't expect a salary for 6 months, and and forgive me if you don't ever get paid. I mean, these are all real conversations I had with them. I said, save money for 6 months. We're just going to work. We may not see any money, And I'll tell you that all these years we've been doing this, we have no liabilities. We have never taken any credit. We have run this company without any liabilities, and I mean that is something that I take a lot of
You
pride
should.
in.
You should. That's something we're very proud of. Wow. So one to 260,000 to 100 million. We're just guessing, estimating. Dr. Ali, that is amazing. Dr.